standing by a little bit after 4 o'clock. You'll hear us testing as always, and you'll hear, this might see some camera movement as we film our cutaways. But please stay tuned. We'll be starting shortly from Geneva. Thank you for your patience.
Good afternoon, everyone. Thank you very much for joining us on WHO Twitter account. Thanks to all journalists who are here in the room, those who are dialing in by phone, and those who are watching us online through Zoom. For those who are online, it's a clicking raise hand to ask questions. For those who are dialing in, it's *9. Today we have Dr. Tedros, WHO Director General. We have Dr. Jaouad, who is Assistant Director General for Emergency Preparedness, and Dr. Sylvie, Director of Global Infectious Hazard Preparedness here at WHO. As always, we will have audio file available immediately after the press briefing, and transcript hopefully will be posted tomorrow morning. I hope you all know where to find those briefing materials. So I'll give the floor immediately to Dr. Tedros for opening remarks.
Thank you, Tariq. And good afternoon, everyone. Let me start, as always, with the latest numbers. As of 6 a.m. Geneva time this morning, China has reported a total of 75,567 cases of COVID-19 to WHO, including 2,239 deaths. In the past 24 hours, China has reported 892 new confirmed cases and 118 deaths. The significant decline in new confirmed cases is partly due to another change in the way China reports numbers. As you know, last week, China started reporting clinically diagnosed cases in addition to laboratory confirmed cases. They have now switched back to reporting only suspected and lab confirmed cases. This may indicate because the health system in Wuhan have regained the ability to test all suspected cases. As a result, some cases that had been clinically confirmed have now been subtracted from the total because they have tested negative. Although the number of cases in Hubei province continues declining, we're concerned about an increase in the number of cases in Shandong province, and we're seeking more information about that. Outside China, there are now 1,152 cases in 26 countries and 8 deaths. Although the total number of cases outside China remains relatively small, we're concerned about the number of cases with no clear epidemiological link, such as travel history to China or contact with a confirmed case. Apart from the Diamond Princess cruise ship, the Republic of Korea now has the most cases outside China. And we're working closely with the government to fully understand the transmission dynamics that led to this increase. We're also concerned about the increase in cases in the Islamic Republic of Iran, where there are now 18 cases and 4 deaths in just the past 2 days. WHO has supplied testing kits and will continue to provide further support. Our concern continues to be the potential for COVID-19 to spread in countries with weaker health systems. Tomorrow, I will address an emergency meeting of African health ministers held jointly by the African Union and the African Centers for Disease Control and Prevention. Meanwhile, the WHO-led joint mission in China has been working in Beijing, Sichuan, and Guangdong, and will travel to Wuhan tomorrow to continue its work at the epicenter of the outbreak. We're working with all of partners under GORN to safeguard the health of the members of the team and to take appropriate measures when they return to their countries of origin. I'm also pleased to announce today that we are appointing 6 special envoys on coronavirus, on COVID-19, to provide strategic advice and high-level political advocacy and engagement in different parts of the world. I'm pleased that the following eminent individuals have accepted my invitation to act in this role. Professor Dr. Maha El-Rabat, former Minister of Health of Egypt, Dr. David Nabarro, former Special Advisor to the UN Secretary General on the 2030 Agenda for Sustainable Development Goals and Climate Change, Dr. John Kengasong, Director of the African Centers for Disease Control and Prevention, Dr. Mirta Roses, former Director of the WHO region of the Americas, and Dr. Xin Yang Su, former Regional Director of the WHO region of the Western Pacific, and Professor Samba Sow, Director General Center for Vaccine Development in Mali. As I said yesterday, WHO's key role is coordinating the global response to the epidemic, and our new special envoys will help us to do that. This is another step we're taking to take advantage of the window of opportunity we have to contain this outbreak. Once again, the measures China and other countries have taken have given us a fighting chance of containing the spread of the virus. We call on all countries to continue their commitment for containment measures while preparing for community transmission if it occurs. We must not look back and regret that we failed to take advantage of the window of opportunity that we have now. I thank you.
Thank you very much, Dr. Tedros. Before taking questions first from the floor then online, just to remind everyone dialing in that it's *9, and those watching us online, it's clicking raise hand on the computer. So we'll start questions from the room. Musa first, please. If you can just introduce the outlet you are working for.
Musa Alfi, Ma question, en fait, l'objet concernant. Donc ma question concerne l'Iran et le Liban. Le Liban aujourd'hui, on a annoncé à Beyrouth qu'il y a un cas en provenance de l'Iran. Est-ce que ces deux pays ont les moyens de faire face à ces virus et quel rôle le WHO peut jouer ou assister ces deux pays à faire face? Est-ce que vous avez des contacts avec ces deux pays pour organiser quelque chose? Merci. So, thank you very much. So
about Iran and Lebanon that have announced cases. Do these countries have a health system strong enough to deal with this, and how WHO can help them?
Non, merci beaucoup pour votre question. Oui, ils ont les capacités de base pour détecter ce type de virus, mais nous sommes en train de discuter avec les deux pays quelles sont les possibilités de coopération et aussi quels sont leurs besoins en assistance technique. La preuve, c'est que le cas du Liban, il a été détecté à l'aéroport. Donc les autorités libanaises ont mis en place un système qui cherche les cas symptomatiques dans les vols provenant d'Iran et qui leur propose le diagnostic et le traitement. Donc c'est comme ça que ce cas a été détecté. Ça prouve jusqu'à un certain point que la capacité existe. La même chose en Iran, et le bureau régional de la Méditerranée orientale est en train de travailler avec eux pour pouvoir un peu évaluer la situation et aussi voir quels sont les besoins en assistance technique de notre part, et nous sommes en contact permanent avec eux.
Can we do a shorter English version, please?
No, I think the two countries, they have the basic capacity to detect this kind of viruses, and the case in Lebanon was detected in the airport because they were screening the symptomatic cases coming from Iran, and this is how this case was detected. And the original office in Cairo is now in contact with the two countries to assess the situation first and to try to evaluate what is the kind of technical assistance that these two countries may need, and we are ready to provide this technical assistance.
Thank you very much, Dr. Mahjour. Yes, please, and then our Japanese colleague, and then we will move online a little bit. Yes, please. If we can just press.
It's Yang with Xinhua News Agency. You mentioned that the international experts group will go to Wuhan tomorrow. So is there any specific steps they're going to conduct in Wuhan?
Yeah. As I said it a couple of times ago, the expert group is fully empowered to suggest and also operate based on the situation on the ground. So that's up to them on what to focus and also the next steps they want in Wuhan. Thank you.
Thank you, Dr. Tedros. Yes, please.
Hello, good afternoon. I am Rintaro from Nikkei Japanese media. You pointed out in South Korea and probably in Japan, in Singapore, it is indeed a fact that COVID-19 has spread rapidly in recent days, although the fatality rate is still low. Even in this situation, do you say that you have not yet observed any clear community transmission outside China? Thank you. Mm-hmm.
Yes, thank you for your question. Indeed, we are looking at the numbers and also working very closely with those countries to try to understand and to give meaning to those numbers. As you know, we have seen in previous outbreak of SARS and MERS-CoV what we call super spreading event. So in those kind of events or situations, we may have a rapid increase in numbers, but as as long as we can understand how the transmission has occurred and how the new cases are linked to this event, then we can also make sure that we can stop the transmission. And so this is the kind of investigation that all countries are doing currently, trying to differentiate, is this a community, a low-level community transmission that were undetected, or do we face this kind of super spreading event where more cases are infected than we see usually with just person-to-person transmission. And so we are monitoring the situation very closely. In South Korea, they are still very committed to stop transmission, and so, but at the same time taking the right measure to contain if we have a super spreading event.
Thank you very much. We will now go to some journalists online. We will start with Mr. Banjo Kaur from India, calling from Down to Earth. Mr. Kaur, can you hear us?
Yeah, I can hear you. Can you hear me?
Yes.
Okay, so my question is to Dr. Tedros. Hi, sir. You said in your opening remarks that China changed the strategy again because their investigative or their surveillance methods have improved. But they started with lab-confirmed cases, then they went to clinical diagnosed cases too, when the number spiked for about 15,000 in a day. And now they have gone back to lab-confirmed cases. So don't you think that this, seesaw has created some sort of epidemiological confusion, not just among researchers, but also among journalists and people at large? My second question is regarding the Diamond cruise ship. Though passengers have started disembarking now, but do you think in hindsight that quarantine of so many people on a ship was a right strategy and it did not go wrong, especially for those people who were on board? Thank you.
Thank you very much, Ms. Kaur, and my apologies for not recognizing that it's a female name. So 2 questions.
Okay. Would you like to start with the first one?
So I think on the epidemiological situation in Wuhan, as we said earlier, and we observe in other epidemics, it's not unusual to count things in a different ways as the epidemic evolves, because as Dr. Tedros said, it's also related to the capacity to have laboratory diagnostics. And so what is really important in epidemiology when you observe an epidemic is to remember that surveillance or monitoring of the disease aims at taking the best possible decision. And so it's really numbers for action and not numbers for numbers. And so as long as we understand how things are counted and what the numbers include, then it helps us to make the best possible decision to protect the health of the people. And so this is why we are in constant discussion with Chinese authorities to understand how things are counted, which basis, and beyond the number, what is really important is the trends, but also the intervention that can be taken to really down or curve down the epidemiology curve. So this is why we are focusing on more understanding their definition rather than really looking at the numbers, because at the end of the day, a small difference in numbers, if it's a good decision behind it, is probably what matters most.
Mm-hmm. For the action taken by in the Diamond Princess cruise ship, I think usually when health authority take any decision, they take it based on the local context first, based on crew risk assessment and crew risk management, and take the decision. And it's very difficult in the middle of the action to look to how this, to some extent, these measures were or not helpful. But what we recommend to all countries is, after the event, to do an after-action review exercise where all the people who were involved in this, including WHO and others to assess the measures taken, to take the lesson learned, and to come up with the solution for the future event.
Okay. Maybe I will add to that. To the first one, I fully agree with what Sylvie said. Then in addition to that, better approach would be to have the confirmed lab cases and suspected cases. We do that for Ebola too, by the way. Until they're confirmed with lab testing, we keep them as suspected, and once they're lab confirmed, then they're taken as confirmed cases. So China has moved into this kind of method, which is in our analysis or in our case better actually, because if you call the clinically confirmed cases as confirmed, when you test it in a lab, the clinically confirmed cases could turn out to be negative. So that's why in a place where we have laboratory capacity, the recommended approach is to have the lab confirmed cases from the suspected cases. So you have the lab confirmed, and then those who are not confirmed yet, the suspected cases. That really brings clarity in the approach, and we're glad that China has come back to that kind of counting, and this will bring clarity actually, and I hope, as you have asked, Namaste by the way, this approach will bring clarity. Then on disembarking, I agree with what Jaouad said, and one thing I would like to add is our advice to Japan and other member states was any action they take, it should be proportional to the public health risk they see. And they have already deployed their experts, and they told us that the measures they have taken is proportional to the public health risk they have seen. So we take that, but as Jaouad said, there could be something that we can learn from, especially when we do the after-action review for the future. Thank you.
Thank you. Thank you, Ms. Gower. And we will go to next question from Helen Branswell. Helen, can you hear us?
Hi. Yes, thank you very much for taking my question. Dr. Tedros, I think it was yesterday you were talking about the window may be closing. Today we've heard that Tehran has announced they have 18 cases and 4 deaths. Likely they have a lot more cases if they've already got 4 deaths. A Canadian who was in Iran has been tested positive in Canada. Somebody in Lebanon who has been in Iran has been tested positive. Is this outbreak at a tipping point now?
Helen, that's why I said many times actually the window of opportunity may be closing. And you have rightly said that, you know, the cases we see in the rest of the world, although the numbers are small, but not linked to Wuhan or China, it's very worrisome. And then Iran in the past 2 days has reported 18 cases and 5 deaths, I think, 4 deaths. This is very concerning. But not only that, there is a case which is linked to Iran now in Lebanon. This is a 45-year-old woman. And these dots are actually very concerning. Take them as dots or trends. So what I believe is the window of opportunity is still there. But where our window of opportunity is narrowing, I would put it that way, narrowing. And that's why we called the international community to act. And that's why I explained yesterday, although we're asking for the international community to act quickly, including the financing, that's not what we see. So again, I fully agree with what you said, but my analysis of the situation is the window of opportunity is narrowing, so we need to act quickly before it closes completely. That's what I would suggest, and thank you so much. It's a very, very important question, and that's what we have been saying since the declaration of FIC end of January. Now already in 21st February. So it is really narrowing. That's how I put it. Thank you.
Thank you very much. Can we take now, if we have online, Walter Yates? Walter?
Walter?
Hello, I am here. Can you hear me?
Yes, please go ahead.
Yeah, I would like to ask Dr. Tedros about something he said yesterday concerning the misinformation spreading on social media. Is something that you would suggest that us journalists do to help prevent that and combat this certain misinformation that is being spread? Thank you.
I think the misinformation, I call it infodemics, is actually causing panic and fear in many places. And from the start of our daily press briefing, we have said a lot about it, and we will continue to really say about it. But not only talk about it and, ask for the international community to act, but we are taking practical measures too, working with Google, working with Facebook, and working with Amazon, Tencent, and so on, to help in addressing this misinformation. And one of the practical actions is these major social media outlets are directing any questions towards the reliable sources like WHO and other institutions in other countries, reliable countries, including like CDC and so on. So that's what we're trying to do, and we will continue to work with them. And scientists have also a role to play, especially in addressing some of the misinformation. As you know, there was misinformation circulating in the social media and elsewhere about the source of the virus. Especially some people believe that it was designed in the lab. But we had, probably you have seen, there was a publication online that refutes that hypothesis and shows that this virus is not actually designed in the lab. Of course, we have to take this study with caution until we get the source. Where the source is, we have to continue to continue our research to really see where the source is. But there is already a reliable article. I hope you will have a look at that. That refutes the claim that this is a virus that's designed in the lab, but further studies will be necessary.
Thank you very much. Let's take one more online. Gracie Wren from Health Policy Watch. Gracie, can you hear us?
Yes. Can you hear me okay?
Yes, please go ahead.
All right. Thank you so much for taking my question. It's a little bit of a follow-up to Helen's question. If the window of opportunity is narrowing as countries scale up preparedness efforts, they also need to prepare to deal with patients with potentially severe respiratory diseases, right? So outside of using screening and diagnostic capacities, what are WHO's plans to help strengthen countries' hospital capacities to deal with these cases, particularly for weaker hospital systems with weaker infection prevention control measures like that? Thank you.
Enough capacity.
Yes. Thank you. Yeah, thanks. So on this issue of strengthening hospital capacities, we act on many fronts. Firstly is working with healthcare workers to give them the right training, and you will see online we have some online courses that they can access, but also provide them with advice on how to protect themselves. And we work closely with a number of countries to make sure that they have enough workforce to deal with a number of cases. And so this is part also of our preparedness activities in many countries, especially when we know that they have a healthcare system that will have difficulty to cope with an increase in cases, in severe cases. So we work with them to identify first where they can hospitalize those cases, those severe cases, and make sure that those few facilities have the capacity to take care of those patients and provide the necessary logistics and supply if needed. So this is part of the preparedness activities that have been ongoing for the past 2 weeks and more focusing on those countries where they are in highest needs. And so this is why we did a strategic preparedness and response plan to prioritize those countries and make sure they have this capacity in hospitals in particular.
Thank you. Can I ask a clarifying question really quickly? So
very quickly.
Yes, thank you. So specifically for respiratory capacity to deal with like severe respiratory cases, you need a lot of specialized equipment in certain cases, correct? So what about kind of that aspect?
Yeah, and so, but what is very important with those cases is first, before being severe, they are usually mild, and we need to also, that's why we focus on early detection of cases, because if we can treat them as early as possible, we have also opportunity to prevent them to become severe cases. So we really try to protect the at-risk population as early as possible, so that we have less severe cases as well.
Thank you very much. Shane, please, we go back to the room.
Thank you. Thank you. Shane from China Central Television, CCTV. My question is about China for Dr. Tedros. So despite the change of the counting mechanism and also some of the Chinese workers are going back to their positions, in general, what do you think about all these changes and also to the measures, and what do you still have the confidence is still that China will defeat the virus soon? Yeah.
Mm-hmm. On the lab, the counting of cases, I have already said it. And taking what we have been doing before with a lab capacity, the best is to have the suspected cases and then take them as confirmed when you do lab tests. That's very clean. So going into that is good, instead of clinically confirmed cases, because clinically confirmed means it could be negative or it could be positive. So that's why we're saying what China chose now is clean. And it's good that they have moved to that. But we also understand, they were using the clinically confirmed cases because it could be because they had the lab capacity was low because of a big number of cases. The most important thing is, based on your situation, to shift into doing the better approach. So we have to be very flexible on that. Then on containing the virus, we still believe that we can contain the virus. And what China is doing, serious measures in Wuhan and Hubei province and others, hammering at the source, can help us to contain it. And other countries, since we have now number of cases, 1,000 outside China, other countries should also be very, very serious. And that's why I said, although the window of opportunity is narrowing to contain the outbreak, we still have a chance to contain it. But while doing that, we have to prepare at the same time for any eventualities, because this outbreak could go any direction. It could even be messy. But what I'm saying is it's in our hands now. If we do well within the narrowing window of opportunity, we can reverse any, or we can avert any serious crisis. If we don't, if we squander the opportunity, then there is a serious problem. There will be a serious problem in our hands. And that's what WHO is saying.
Okay, so there's also part of my question about the workers or the employees going back to their work. So what do you think about that? Because that will definitely help the China recovery from the economy. But
that's what I said. In China or other countries, our advice is to take measures very proportional to the public health problems they see. That's our advice. And I hope China is doing that and other countries are doing that.
So you encourage the workers to going back to their positions?
We don't go into specific recommendations because we have to, see, the details of what's happening if we're going to recommend, and we need to sit together. But with the question you're asking and, what we would recommend as or put our general position is to encourage countries to take measures which are proportional to the public health response. Thank you.
Let's see if we have, Jamie was raising his hand.
Go ahead, Hugo. Go ahead.
Okay, so please.
I was showing you also this side because it's tired of.
Yeah.
Thanks, Hugo Miller from Bloomberg News. It's on, yeah. It sounds like you're comfortable with the methodology, the shift in methodology of clinical versus lab testing in China. But just today, 200 cases were reported from prisons that had previously been excluded. Are you comfortable that the methodology now is something you can understand and relate to, and there will be no more surprises? And is there any concern that in a rush to reach a conclusion that net new cases in China are dropping, that not every potential case is being considered in their methodology? Mm-hmm. Thanks.
The international experts and Chinese counterparts, the joint mission, is working together. So if there are unanswered questions, they will tell us. Thank you.
Very quick on Iran.
On Iran, are you getting you said you're particularly concerned about cases that don't have a direct link to China, and Iran to Lebanon is now a worrying link. Are you getting the information you need so far from Iranian authorities?
We're getting information, but we have to engage them even more, because in 2 cases, having 18 cases and 4 days in our hands is serious.
Thank you. Thank you very much. Jamie, please, and then John, and then we will see if we have time for one more line, and then we will have to conclude. Jamie, very short question, one question.
1.5.
Hi, Jamie, Associated Press. Just wanted to know, you've talked a little about these clusters, but these clusters that are far from China, what does it say about this phase in the outbreak? Are we getting closer to a pandemic? And could you just give us a quick update about the infection spread in healthcare settings, both within China and outside of China? Thank you.
Okay. So I think indeed what we see is a very different, I would say, phase of this outbreak, depending where you look. And for instance, there is a situation in Wuhan, which is a special type of situation. We have also a situation in different provinces in China. And then we have what is happening outside China, where the number of cases is still very limited. And this is why we are also able to see a different cluster of cases and investigation on this cluster. So indeed, we see that the situation is evolving. Not only the number of cases is increasing, but also we see different patterns of transmission in different places. So and this is why we are monitoring it, and Dr. Tedros kindly organizing this press conference to just showing that we are monitoring the situation, looking at what is happening everywhere, trying to have as much information as possible from each of these situations, and we are closely working with countries to have the more detail possible to try to understand really what is going on. Is it the same type of transmission as we have seen at the early stage of this outbreak, or are we moving to another phase of the epidemic? And so we try to also qualify as much as possible this situation, but you understand that we have a lot of diversity, different outbreaks showing different faces, and so that's why we try to make sense of all those different experiences we see across the world. But as Dr. Tedros said, we still have this window of opportunity, because we think that even if in some places we see a large cluster of cases, it's still we can monitor where they are coming from and what is going on. And so we need to continue to monitor the situation very closely until we can say that the situation is completely different.
Mm-hmm. Okay.
Healthcare settings.
Healthcare settings. You want to do?
Yes, okay. So similarly, in healthcare setting, we have seen different patterns, including in China, because nosocomial transmission has happened at the early stage of the outbreak and was based probably on the lack of knowledge about the disease or the virus itself. But we have seen also that these nosocomial transmission, when healthcare workers were aware of the disease and the virus, we have seen a decrease on those transmission. So it's a good sign. It means that with knowledge, we can reduce the risk for those professionals. However, we see as well that when healthcare workers are overworked or not in enough numbers, then the infection prevention and control measures are less strict, and then they have more risk to be infected. So we are continuously trying to investigate those transmissions, just to make sure that we know really what is happening, and we can propose the best countermeasures, especially in hospitals, and make sure that we are not missing any potential mode of transmission that could put healthcare workers at risk.
Yeah, I fully agree with what Sylvie said. Overworked health professionals a risk. In addition to that, health professionals that are not properly protected. And that's why in our presser last week, we raised the alarm of having shortages in protective gear, major, basic equipment that health workers need. And that's why I have already asked major companies, around 14 of them, if they could help us in providing the necessary equipment, PPE, so that we start from protecting our health workers. When a health worker is infected, it's serious. And nosocomial transmission is one of the methods of transmission that can really spread actually anything in a very high rate. We have seen it in Ebola, and it can happen also in Corona. Then, are we closer to pandemic? I would like to assure you that we're following this virus 24/7, round the clock. And I don't know if my colleagues actually are taking enough rest. And we're involving the best experts globally. And we're discussing regularly with the international experts we have, good number of them representing all regions and excellent experts. we have weekly consultation. But we have also internal experts, and we assess the EP we have regularly. And as you know, we have other platforms that we're always checking what the situation looks like and where we're headed. So we will continue to follow up, but as we speak, our situation is that we're still in a phase where containment is possible with a narrowing window of opportunity. And if there is anything move into another level, then we will announce it as soon as possible. We'll be the first to tell you that we're shifting into another level.
Thank you very much. We have time for two very short questions. First in John, and then we will go to someone online. John, please.
Yes, good afternoon. John Zarakostas for The Lancet and France 24. Dr. Tedros, could you elaborate a bit, or perhaps your colleagues on the podium here, the virus, the new cases in Iran, is the virus still stable? You said that it's a very worrisome situation. And secondly, you've got now an outbreak in a country that's subject to strict sanctions by the UN system. Could that be a hindrance, or you have assurances from the international community that that will not impede your ability to act in Iran?
Give a start. So on the virus itself, I don't have yet the ID of this virus, but what we have seen in previous sequencing that were done in different places, it was quite stable. So I imagine that it's not different here, but the concern is more about the fact that we have seen an increase in cases, very rapid increase in a matter of few days, and so we were just wondering what is the extent of this outbreak and the transmission in Iran, and also because we have seen other cases picked up in Lebanon and Canada, so we are just wondering about also the potential of more exported cases in the coming days, and that's why it's concerning, because we would like all the countries in the world to be aware and to make sure that they will also put in place the right detection measures so that we can pick up those cases as early as possible, and not allowing this virus to spread further in the coming days. And so this is on the virus itself.
Okay.
There was a question
on the sanctions. You want to
on sanctions, as you know, in emergency situations, mainly during any what do you call it, outline the terms of sanctions, emergency situations are excluded. So we hope we will have all the opportunity we need to support.
Thank you. Was there any question here in the room? Yes, please. Sorry, I didn't see you, so please.
You mentioned your concern about these dots and what that might say about the potential to move into another phase of the virus. Just linking that back to the post-action assessment on board the Princess cruise ship, do you see that post-action report as potentially useful to people potentially dealing with new clusters? And if so, how quickly will that post-assessment report be completed, and when will we find out the results?
The after-action review is usually a process led by the country where the event is occurring, and with the help or not of international agency. And we will definitely propose this action review to the Japanese authority and to try to do it together. But the major expect the outcome of this exercise is first to study the situation, to see what's done well and not well, and also to come up with lessons learned that help nationals to improve, but also guide WHO and help WHO to improve their guidance, and not only WHO in this case. Other agencies who are dealing with ships and boats will also be inspired by the after. It's a learning exercise where we come up with conclusion to improve the global community preparedness in the future.
Thank you very much, and we can take one last question if everyone agrees. That's from our friend Kai Kupferschmidt, who is online. Kai, can you hear us?
Yes, thanks for taking my question, Tariq. So, Tedros, you have been very clear about the strategy on this. Hammer the virus in China at the epicenter, try to keep it from spreading. You've also said that the window to do this is narrowing. I mean, we all know that we have to think in scenarios. So what I really wanted to ask you is, at what point do you consider that window closed? What has to happen for you to consider that window closed? And what is the strategy the WHO shifts to at that point?
No, thank you, Kay. I don't want to preempt the thinking of the scientists we're involving. And as we speak, they're actually engaged, and they're really working on all the data we have. And we will expect, their analysis and also recommendations. And we're involving as many experts and very known and respected scientists as possible from all over the world. And I know when we finalize the analysis, we will get a very good quality analysis based on science and evidence, and we will announce that as soon as we have it. So we're working on it. We're following the situation 24/7, and we will tell you exactly what the outcome of that analysis is as soon as we're ready.
Thank you very much, Dr. Tedros. We will conclude with this. Thanks everyone for watching us. As we have announced to Geneva-based core, we are not planning to have press conferences over the weekend. But if that changes for whatever reason, we will let you know. Thank you very much. Ciao.